Hi, I'm Jonah Comstock, editor-in-chief at pharmaphorum. It's day 4 of ASCO here in Chicago, and I'm joined by Dr. Rahul Winayak of City of Hope.
Yes, thank you so much for having me. Really nice meeting you.
Yeah, thanks for chatting with me. So I was
Sure.
excited to see your abstract because it deals with the microbiome,
Right.
which I think is a space that doesn't get enough attention.
Sure.
And so I'd love to hear, first of all, about the study you did and what you found. And then we can talk a little bit about microbiome and oncology and where that's going.
Perfect, that sounds great. So we actually had, conducted 2 phase 1 clinical trials looking at standard of care regimens in the first-line setting for metastatic renal cell carcinoma. So this is nivolumab, ipilimumab, and nivolumab cabozantinib. And we added on a live bacterial product called CBM588 to those in one arm. And so what we showed in our study was that when we combined the patients from both trials, we showed that the response rate was significantly higher in those patients that received the live bacterial product, CBM588, so at 69.2% versus 20%. Similarly, the disease control rate was a lot higher as well, 79.5% in the experimental arm versus 35%. So
Wow.
really profound benefits. And I guess that was also translated in a progression-free survival benefit as well. At a median follow-up of 44.2 months, the median progression-free survival was significantly higher in the experimental arm with the live bacterial product CBM588 at 32 months versus 3.7 months without. So very exciting signals for efficacy. But then what we really showed in our study was looking kind of, why is this happening? What's the real mechanism behind it? And so we discovered in the literature there was something called a TOPO score. And this is basically a stool metagenomic dysbiosis index that's linked to ICB outcomes. And so it was originally postulated in the non-small cell lung cancer space, but it's recently been added as well in kidney cancer. But it's still very investigational. But essentially what it's looking at is essentially your good and bad bacteria in your gut, right? And it's working out, whether you fit more in a dysbiotic, or a SIG1 genotype, or more in a non-dysbiotic or SIG2. And so what we specifically showed in this study, in the ASCO, which was presented just actually in the morning, was that those patients, that exhibited a SIG1 or a dysbiotic genotype, seem to exhibit a more profound PFS benefit with the addition of that live bacterial product compared to those that didn't have dysbiosis. They still had a benefit, but it wasn't as profound as those that were dysbiotic. And similarly, when we looked at it from a quantitative point of view of baseline S-score, we showed that basically patients who had a higher baseline S-score, they seemed to have, be more responders compared to those that didn't. But specifically, we saw, because in our 2 trials, we looked at in one trial, nivo-ipi, and one nivo-cabo, we showed that actually in those patients which had the pure immunotherapy backbone on nivo-ipi, actually that if the higher baseline S-scores seem to correlate more with responders compared to those in nivo-cabo. And taking all that together, it shows that this TOPO score, this kind of potential biomarker, seems to be most promising within the space of kind of dual immunotherapy compared to those receiving kind of combinations of TKI and checkpoint inhibitor.
So we're not even talking about like a cancer in the gut, right?
Right.
So that's the part I think it's hard to wrap your head around is what's the connection between your microbiome and this cancer?
It's really interesting you point that out. Essentially, with this live bacterial product, what we're showing is that preclinical models have shown that it actually produces a certain short chain fatty acid, and kind of that's hypothesized to make kind of that gut barrier, make sure it's more intact. And as a result of that, what it means is that there's less low-grade inflammation constantly in the gut. And so, all that kind of immune response seems to be reserved so that when we do give the immunotherapy, it hits the cancer. So that's kind of the hypothesis. And I think what's really exciting is there's a new phase 3 trial, which has just been recently activated called Biofront. And they're going to be testing this exact same live bacterial product, CBM588. So I think they'll elucidate more of the mechanisms as to why this is happening.
How was this bacterial product, how was it found in the first place? What's the story behind this?
Sure, actually it's from Japan. Initially, they take it in Japan for regular GI ailments, which is really interesting. But it was the first published report for CBM588 was within the non-small cell lung cancer space. And it was actually a retrospective study. And they showed, I think it was around 130 patients or so. But those patients that had, checkpoint inhibitor with the CBM588, they seem to exhibit a higher PFS than those that didn't have it. That was a retrospective study, and our group was one of the first to actually show it in prospective randomized phase 1 trials with kidney cancer that this does seem perhaps to be a benefit. And I guess, as you said before, the phase 3 trial, Biofront, will really kind of confirm that hopefully, and also work out why that's happening.
Fascinating. Yeah, I've been fascinated by the microbiome for years, and I've met some really interesting, really smart scientists who are working on it in various areas. And I think that there's a lot of stigma there, and there's a lot of kind of like skepticism. So something like this where you start to see real strong data, and I mean the numbers that you mentioned are pretty
They're
dizzying.
staggering. Yeah, they are staggering. Exactly. I would like to note that these are phase 1 trials, and of course they are a small number of patients, right? 59 in the total if you add the 2 trials together. But nonetheless, there really is something going on here, right? We can't dismiss it. And so again, putting it back, I think that phase 2 trial is going to really help in that space. Yeah.
Yeah. So, I mean, how do you think about this space in the long term? I mean, you're a fairly young scientist early in your career. This is like an exciting space to be in the sort of, not the ground floor, but one of the low floors of.
I'm so excited and thrilled to be working at City of Hope. I only joined about 3.5 months ago, but City of Hope's really a world leader, in my opinion, in the microbiome space. Recently in May, we held a symposium where we brought together all, the world experts in the microbiome from the NIH and many different other institutes. And we really kind of convened to demonstrate that the gut microbiome is no longer just some sort of association, right? It seems to really be a therapeutic index. So something that we can really kind of challenge to try to improve responses to therapy. So there's so much that's happening at City of Hope, right? So of course we've had these 2 trials in kidney cancer, but then beyond that, we're also looking at it from the point of view of fecal microbial transfer, which is another really hot topic actually, where they take, the actual stool from either patients who respond really well from immunotherapy or from just healthy donors, and they kind of just give that first via colonoscopy and then later on by tablet. It doesn't sound too, appealing, but it does really seem to work, and they've shown it in this phase 2 trial in Italy that it's actually very exciting. So it's proof of concept, and I think scalability might be tough for something like that, but nutrition is coming into play as well. So I think fiber is a big thing, and I think we're showing that fiber seems to modulate the microbiome even more and improve responses. As I say, City Hope's doing a lot in the field, and I'm just very excited to be part of it.
Yeah, I mean, it's exciting stuff. I'm very very happy to get to hear a little bit about it, and we'll definitely be keeping an eye on it going forward.
For sure. Thank you so much. Really great meeting you.